Question. A 72-year-old man with a history of hypertension, hyperlipidemia, and coronary artery disease presents to the emergency department with severe chest pain and shortness of breath for the past 2 hours. On arrival, he is confused and diaphoretic. Vital signs: BP 80-50 mm/Hg BPM, RR 24 breaths min, oxygen sat 92% on room air. On physical examination, jugular venous distension, JVD, is present. Lung auscultation reveals diffuse crackles. Cold, clammy extremities. Cardiac auscultation reveals an S3 gallop. Electrocardiogram, ECG, shows ST elevations in leads 2, 3, and AVF. Which of the following is the most appropriate next step in management? A. Normal saline bolus. B. IV furosemide. C. Norepinephrine infusion. D. Immediate percutaneous coronary intervention, PCI. E. Intravenous beta blockers. Answer and explanation. Correct answer D. Immediate percutaneous coronary intervention, PCI. This patient is in cardiogenic shock due to an inferior ST elevation myocardial infarction, STMI. Cardiogenic shock is characterized by hypotension, SBP 90 mm/Hg, signs of poor perfusion, confusion, cold extremities, oliguria, elevated JVP and pulmonary congestion, crackles, S3 gallop, edema. The definitive treatment is early reperfusion with PCI or thrombolysis if PCI is unavailable within 90 minutes. PCI restores blood flow, improves cardiac output, and reduces mortality. Why not the other options? A. Normal saline bolus worsens pulmonary edema by increasing preload in a failing heart. B. IV furosemide used for acute decompensated heart failure, but not in cardiogenic shock, as it does not address the underlying problem. C. Norepinephrine infusion can be used for supportive BP management, but PCI is the priority. E. Intravenous beta blockers, contraindicated in cardiogenic shock, as they reduce contractility and worsen hypotension. Key takeaways for cardiogenic shock: MI, heart failure, valve disease, arrhythmias. Signs: hypotension, cold extremities, JVD, pulmonary edema. Treatment: emergent PCI or thrombolysis. Inotropes: dobutamine, norepinephrine for hemodynamic support. Avoid excessive fluids and beta blockers.